All right, welcome back to the show, everybody. On today's episode, we have a very special guest, Ryan Murray. Ryan, how you doing, sir?
I'm doing pretty good. Thanks for having me, Rich. How are you?
I'm good, thank you, sir. I had a pretty rough morning. I didn't sleep very well, but I'm really excited to get to know you and your practice. So with that being said, for those of us that don't know anything about you, do you mind sharing a little bit about yourself and what you do, please?
Yeah, so I am a licensed clinical mental health counseling associate, and I'm also a certified rehabilitation counselor. And I work out of I'm licensed in North Carolina, and I practice out of Cary.
Nice. And so who do you kind of see in your practice, Ryan?
So I see people 18 and older. Primarily, these are people who have burnout, anxiety, post-traumatic stress disorder, or kind of going through some life transitions.
Got it. Okay. And what are what are the people that come to your practice kind of present with? I know you just mentioned some of it, but do they have maybe some depression along with that, anxiety, other things? What does that look like?
Yeah, so I will say a lot of people have kind of comorbid issues or kind of multiple concerns going on. So I'll see a lot of people that also have like depression and ADHD or anxiety and PTSD. Maybe they have an identity exploration they were wanting to do and they're having some anxiety or depression around that too.
Got it. Yeah, that makes sense. Ryan, how do you ensure that the client is a good fit for you and that you are a good fit for your client?
So I first off like to inform clients like, hey, this is your journey and you have the right to kind of say yes or no to things you do or don't like. If I'm not a good fit for you, please either let me know if you think it's something I can fix, or you can just say, hey, this isn't right for me. So I like them to know that right off the bat. So at any point they can feel empowered or comfortable to speak up if they want something to change, or if they feel like it's just not going to work, because it is their journey. They are the experts on themselves. And for me, knowing they're a good fit, I have some kind of screening questions. I want to make sure I'm able to best suited to help them. For example, like working with people that have schizophrenia, that's not my area of expertise. So if they have like anxiety and schizophrenia, I could work with them on anxiety, but I'd want them to have another provider that's more of an expert on schizophrenia.
Got it. That makes sense. So you're very nuanced with your approach as far as like who you can help and what their presenting concerns. Does that sound about right?
Yes, yeah. I don't want to work outside my area of expertise. I want to make sure I'm able to help people.
I commend you for that, Ryan, because it takes a lot of courage to be able to say no. Because as much as we want to help everybody, like we also recognize the limit of our expertise, and I just appreciate that you're keeping the best interests of your client in mind. So kudos to you, sir. Ryan, I like to shift gears and ask about your specialty. There's a lot of specialties out there: CBT, DBT, Gottman, all the wonderful things. How would you describe your specialty in simple terms?
Simple terms. So I would say I'm a CBT, or the cognitive behavioral therapy based. I really like looking at people's thought patterns and helping them kind of gain some insights into what's going on in their lives and trying to challenge these patterns they've established to see how we can best improve their lives.
Ryan, what does CPT mean?
So CPT stands for Cognitive Processing Therapy, and it is one of the gold standard treatments for post-traumatic stress disorder, or PTSD, as I said earlier. And it is a variable length treatment, which means sometimes people take 6 sessions of CPT and sometimes people take like up to 14. The standard dosage is 12 sessions though. And people normally do it once a week, but it can be done multiple times a week too. But as long as it's done once a week, that's kind of where we start to see like the best results. And it's different than kind of just traditional talk therapy. So there's it's manualized. So there's certain things that are covered in each session. And there's homework that goes along with it too. And when I say homework, it's really like skills based through a worksheet to help people identify how traumatic symptoms are impacting them. And then we kind of build on it to see how it's impacting them, what areas it might also be impacting them that they didn't realize, how they can kind of interrupt those thought patterns, and how they might be able to kind of replace them with something else. And kind of the first beginning of the therapy is focused on developing those skills. And then kind of the second half, there are these modules that kind of focus mostly on like self-esteem, intimacy, trust. So kind of common things that we see people struggle with after experiencing a traumatic experience.
Got it. Yeah. Ryan, that's one of the CPT is something that I haven't heard about before. Are there any misunderstandings or misconceptions about CPT?
Yeah, so I think there are a few out there. I think EMDR is more popular right now. There's kind of better marketing for it, but CPT is also well established. There's a bunch of research behind it showing that how effective it is. It's specifically for PTSD, but like I said earlier, it helps people with comorbid conditions. And some people think they need to address things like depression or substance use before they address the PTSD. But with CPT, you can address both kind of at the same time. So I think people understanding they don't have to like do extra prep work before treating the trauma symptoms is important to realize. And then sometimes people think like, oh, like I'm gonna forever be in treatment. It's gonna take years and years and years for the trauma symptoms to kind of go away. But that's actually not true. Like I said, CPT is variable length. So most often people will have 12 sessions and they'll feel significantly better. Some people start feeling better around session 6. So they could be as few as six sessions too.
Wow, yeah, that's awesome, especially in today's age where insurance is really pressing the clinicians to achieve rapid results, right?
Yeah.
And so it sounds really, really awesome that CPT can really facilitate rapid change or at least rapid progress in your clients. Brian, so let's say somebody reaches out, they do the initial consult call. I mean, I don't remember that you mentioned doing consultation calls. Do you do those?
Yes.
Okay.
So I do a like free 15-minute phone call or video chat for everyone that wants to.
Oh, nice. Okay, got it. So let's say somebody partners up with you, and there's a good fit there, and then they show up for the first session. What does the first session look like?
Depending on if we're doing the CPT or if it's for something else, if it's something else, we'll kind of focus on doing just kind of their life experience, what their goals are for session, and anything important they want me to know about previous mental health treatment experience that they've had. And then, of course, there's things like the insurance and all that too. And with CPT, mostly we're focusing on one particular traumatic experience or closely related traumatic experiences, and kind of helping clients understand how that has impacted them. And then kind of later on, we'll figure out how that is related to other things in their lives.
Got it. Yeah, that makes sense. Ryan, so let's say somebody reaches out, they do the consultation call, first session goes well, that's a good vibe, and then they decide to continue sessions. What does progress look like if somebody partners with you?
Yeah, so I think when I think of progress, I have two ideas in mind. One, I want to see negative symptom reduction. So that might be like the intensity of the anxiety, how frequently people might feel the need to kind of withdraw, or how frequent people are kind of avoiding certain things that bring them joy. So I want to see a reduction in that, but I also want to see an increase in positive symptoms. So that can be like happiness, being more social, kind of more social connectedness. And then I take my goals with those two and put it kind of with what the client's overall arching goals are. So maybe they want to be better at their job or something. So then we look to see, are there going to be like less mistakes happening, and are they feeling more rejuvenated by their work and stuff like that.
Oh, awesome. Yeah. And I think this is the first time I've heard somebody say not only a reduction of symptoms of those adverse kind of not serving the client symptoms, but also an increase in positive behaviors or positive symptoms. And so that's really cool. I like that you take that kind of two-pronged approach with your clients, because I resonate with that. It's not always about reducing the bad, but also increasing the good, and so that's really cool.
Yeah, I've seen a lot of just kind of focus on the past, on just reducing the negative, which is important, but it's also like we need to have like good things happen for us too and acknowledge those as well.
Yeah, absolutely. And it's like two sides of the same coin, right? We can't just look at one side always. We got to explore both, So yeah, I appreciate that, Ryan. Sometimes clients come in and they're looking for a timeline. They're like, hey, how long is it going to take? 8 weeks, 12 weeks, whatever the case may be. How do you prepare your clients for that possibility that one, there is no timeline. Two, that progress can be looking like taking one step forward and maybe a couple steps back sometimes?
Yeah, so I kind of, again, if it's CPT, we kind of set like the expectation we'll be meeting like once a week, because it's not as effective if you meet less than once a week. But if it's kind of general other concerns, what we'll do is first I want to ask what the frequency of what they want to meet is, and then I try to inform them kind of how mental health kind of can fluctuate. Where it's, like you said, kind of 2 steps forward, 1 step back. That progress is not always linear. And it's okay that people will make mistakes or things won't always go our way. So we want to kind of establish and foster resiliency in our clients. So that's kind of like a general spiel or like a summary of kind of what I'll give at the beginning while we're session planning. But then I also tell people, I am not going to put more work in than you are. If you want your mental health to improve, you need to take like an active step in the process, which they've kind of started by coming in and doing the first session. But if they want to meet once every month, we can meet once every month. It just might not be as impactful for them. And I know there's a lot of considerations with that, like what they have going on outside of therapy, like work, family, also like finances. So I try and do a sliding scale too.
Got it. Yeah, that's really cool. Speaking of your, as you were saying that, something stood out, and that was like how you brief your clients or how you prepare them, and you mentioned, I think, if I remember correctly, you said that sometimes you can be direct with them regarding the approach. With that being said, Ryan, I'm curious, some clinicians are very direct. They're always driven for solutions. Others are very laid back and they let the client lead. Some involve humor, some don't. Some keep it very, very professional. Others do some self-disclosure. There's a whole variety out there. And I'm curious, how would you describe your personality, so to speak, in session?
Yeah, so I tend to be more direct than not. I just like kind of cutting to the chase, unless it's something like I'm trying to help people establish insight. I'm not going to push kind of what I think is going on or what might be happening onto them until they can kind of realize themselves. I also personally do not like hierarchy in therapy, so I kind of try and be more relaxed and not super uptight. While I might be the expert on therapy, clients are the expert on themselves. So I like to think of it as a collaborative process. And I really do like to use humor. I think it helps build rapport, but I also think it can help make things seem not as heavy. I don't use humor, though, to make light of anything serious that we're talking about. I only do it when I feel it's appropriate.
Yeah, no, for sure. Humor is one of those very dicey things to use, because I've had personal experiences with clients where we're having light banter and we're kind of joking back and forth. Usually at the start of a session, how it's like, hey, how was your week? How did everything go? And they're like having fun. They're excited about whatever happened. And then they crack a joke, sometimes self-deprecating humor or something. And then, just naturally because of the tone of the session and how they said what they said, and then there's a chuckle and they're like, oh, that's not funny. And then you're like, sorry, I didn't mean, and so, yeah, definitely as a clinician, we have to be very careful with humor, but when it's delivered appropriately, it can be very, very powerful. So
Yeah.
Yeah, I appreciate that approach, Ryan. All right, so let's say somebody continues doing the work, and they're showing up consistently. How do you know when it's time to maybe graduate, if that's an appropriate word, or terminate a client?
Yeah. So I like to use measures when I'm doing therapy. So there's the PTSD checklist that I'll give, or it's the abbreviation is the PCL-5. So I administer those before session. I also administer the patient's health questionnaire, or the PHQ-9, which is for depression. And so those I kind of give to everyone. And depending on what we're meeting for, like if it's PTSD with CPT, we give those every week. If it's something else, might give it every other week or once a month, depending on how frequently we're meeting and what people's concerns are. And I have some other ones too for like ADHD symptoms, maybe problematic anger and stuff like that. So I like to see progress that way. And then I kind of share any trends that I'm seeing with the clients. So I'm like, hey, you started here and now you're hopefully they're feeling better, mostly like it's trending down for most of it. That seems to indicate progress to me. How are you feeling? Do you feel like you need to either like reduce the amount of time we're seeing, or maybe you're feeling like you're ready to kind of graduate or end therapy for now?
Yeah, I love that, Ryan. Sorry, I didn't mean to cut you off if you were going to continue.
No.
Okay, got it. Yeah, I appreciate that you get feedback from the clients using measures, because those could be very powerful way to collect that feedback, and so, yeah, that's awesome. Let's say they are ready to terminate, and they're like, you know what, Ryan, like, I feel like we're kind of done with the issues I came in here for, or help with. What does like that last session kind of look like?
Yeah, and so for the last session, I always like to say we can work on other things too. If things come up, feel free to reach back out to me, and we can schedule. I also like to let people know that when appropriate, like I can send them some resources or things like that for maybe peer support groups in the community, or maybe book or podcast recommendations on things that we talked about in session that they might still benefit to learn more about. But otherwise, I just like to say I thank you for the time that you've dedicated to helping yourself and the time you've showed up and all the energy and effort you've put in. And I hope that this was a mutually beneficial experience, because I learn stuff from my clients too.
Yeah, absolutely. That's great, Ryan. All right. So let's say somebody's listening to this podcast episode and they're liking what you have to hear. And maybe they're thinking about partnering with you, but maybe they're reluctant because they've never seen a therapist,
Mhm.
or even reached out to anybody in the mental health field. What would you want them to hear?
I want them to hear that we are here, mental health professionals, and we're ready to help people. And it's important that they feel safe and ready to do the therapy and do the work that they want to do. No one else can make you, well, people can make you do therapy, but it's not going to be as effective or as meaningful to you. So I recommend do some research. Psychology today is a good way to filter through and see therapists that treat the kind of issues or have the expertise that you're looking for. Talk with your friends and family that might have done therapy and see what they liked and didn't like. But really try and feel comfortable as best you can. I know it's nerve-wracking for everyone. I've been in my own therapy and I remember how nervous it was kind of the first time. But kind of do your research. And I like to tell people that even if you have a negative experience, you can always leave the therapist or kind of address what was going on that maybe didn't feel so great. And maybe that can help you move forward.
Yeah, that's awesome. What great suggestion, right? So I appreciate that. Thank you. I like to shift gears a little bit and ask about you specifically. Is that okay?
Yeah, totally.
So what motivated you to be a therapist in the first place?
Yeah, so I really liked kind of the mind. I really enjoyed my psychology classes and kind of some of my neuropsych classes that I took in high school and kind of undergrad. And my first kind of internship I did at a warming shelter back in my home state of Wisconsin. And so I did like the intake interviews, and I got to ask a lot of people kind of some tough questions, and they'd had really difficult life experiences, and I was able to provide a safe space for them. So that felt like really meaningful and rewarding to me. And I like to think that I was able to help them feel safe kind of while they're in a dire situation. And so I felt like counseling and therapy was a good melding of kind of learning more about the mind and being able to help people, like those at the warming shelter. And then I was able to get into my own therapy, and it was really helpful and impactful for me. And then I was able to also job shadow a therapist, a cognitive behavioral therapist, that I was able to witness the impactful changes and like the hard work that people had done over years of therapy and see how much better their lives were. And I was like, okay, that's kind of what sealed the deal for me. I'm like, I can help people in a meaningful way that is also like interesting and fascinating to me.
Yeah, that's awesome, Ryan. And of all of the professions out there in the mental health field, we have marriage and family, we got social workers. Why did you pick mental health counseling?
Yeah, so I think it has a lot to do with the cognitive behavioral therapist that I job shadowed. She was a mental health counselor. So that's kind of the area that I felt most familiar with. I also don't work with like couples and like families usually, just personal preference. So I knew I didn't want to do marriage and family. I had kind of some frustrating experiences with internship working with um, parents of children and having to like send children back to kind of not, they weren't like abusive situations, but they were maybe not the most mentally healthy situations to send them back to. So there wasn't much progress being made, and it was just kind of burnout inducing.
Yeah, thank you for that, Ryan. What do you enjoy most about your work?
I really enjoy the feeling of creating a safe space for someone who maybe hasn't had that space created for them before, and helping them realize, oh, it's okay. There are people out there I can trust. There are people that will help me and want the best for me. I have a lot of people that either haven't had that experience before, or it's been a very long time and they've kind of lost faith in helping professions, whether that be like um, doctors or physicians, or it could be they've had negative experience with therapists before.
Yeah, yeah, absolutely. Ryan, what's on the horizon for your practice? I know you mentioned you're an associate, so like me, you're probably chipping away at those hours towards full
Yes.
licensure.
Yeah.
But outside of that, what are your plans? Maybe are you in the future kind of thinking about a private practice or running some groups, or what does that look like?
Yeah, so I guess I should say currently I work at Soul Centered Integrative Wellness. It's part of a group practice, so I'm an outpatient therapist there. Um, and I also do assessment and some treatment research at the VA. So I see a lot of effective treatments out there. And one of those is called written exposure therapy. It'll be often abbreviated as WET, which I think they could have done a better job at marketing that. But that is like a short 4-session treatment for PTSD. And it has been showing a lot of promising results. And I feel like it's a good way to offer treatment for people that maybe are in a transitory part of their life where maybe they don't have super stable housing, or it's good for like people that have time off of work. So it could be like teachers during the summer, they can get effective trauma treatment, or students can while they're off, or people like before they get deployed, if they know it's coming up. So in addition to that type of therapy that I would like to learn and be trained in, I'm also getting trained in the CAPS 5R, which is the new revised gold standard assessment for PTSD. And it stands for the Clinician Administered PTSD Scale for the DSM 5 TR. And so I feel like that will be able to help people see how impaired or how hindered their life and their quality of life is from PTSD. So I can offer that at the beginning of CPT or at the beginning of WET, to help people kind of understand where they're starting from and maybe helping them realize where they want to end up at.
Yeah, those assessments can be tough, and I really appreciate, and again, kudos to you for really undertaking the assessment training, because it's tough to do assessments. They're
Yes.
long. It's a lot of questions, and sometimes when it's a client's first session is an assessment, and
Mhm.
they're just like, they don't know what to expect. They show up and it's just like, hey, I have 300 questions for you, and it's going to take about 90 minutes or whatever. You know what I mean? It could be,
Yeah.
it could be a challenge, So kudos to you, sir, for being the first line of defense, so to speak, with the client. Ryan, I'd like to switch gears a little bit and ask, how do you spend your time outside of the office?
Yeah, so I think as I've become, since I've become a therapist, that's been like really important to me to make sure that work-life balance is there. I spend several hours a week outside. Like I said, I'm originally from Wisconsin, and the state's very cold most of the year, lots of snow. So I really appreciate here in North Carolina being able to walk around outside, see nature. So I will go several nature walks a week. I also had a professor in grad school that said it's important for her to see a body of water twice a week or 3 times a week, something, an arbitrary number kind of like that. And I really like that. I find water to be very calming. So I will kind of drive to a lake, or maybe just like there's a river or a creek nearby my place, that kind of helps ground me and makes me appreciate what I have now versus kind of where I was in the past. I also really like tennis. Not super great at it, but I like to play tennis a few times a month. And again, that's like really nice for me because I played it in high school and we could only play a few times during the year back in Wisconsin, but here's more of a year-round option. And I really enjoy my breaks away from work now. So I like to travel a lot. I recently was in Turkey and Bosnia and Herzegovina. So I like being able to see the world, learn about different cultures and stuff. And I feel like that also helps me kind of have cultural humility in my practice too. I'm not knowledgeable about everything. So I try my best to kind of approach things I don't know as well about from the lens of humility. And it's okay if I ask questions occasionally. Mostly I do that outside of session and do some learning on my own. I don't like to put the burden of learning or explaining things on my client if I don't know things. But I think it's important as therapists that we put ourselves in situations where we might be uncomfortable because we aren't as familiar with things, and grow from that. And I feel like traveling has been a great way for me to do that.
Oh yeah, that's awesome, Ryan. And on the topic of tennis, are you any good at pickleball?
I've only played pickleball probably twice. I'm okay at it. I definitely prefer tennis, but I really enjoy, like, I feel pickleball is like easy to do. It's not as intense as tennis.
Gotcha.
But the main reason I feel like I prefer playing pickleball with like 4 people total, including myself. Tennis, I'm like, oh, I just need one other person, and I can
Got
usually
it.
find one other person to play with me.
Oh, you do singles on the tennis
Yeah.
court? Got it. Okay, cool. Yeah, Ryan, thanks for sharing that. If somebody really likes what you're saying, how you present yourself, and they want to partner with you, how can they reach out?
Primarily, Psychology Today is where you can find my information. And I prefer people kind of reach out to me via email, but I also have a phone number on there. You can also go to our practice website, which is Soul Centered Integrative Wellness. And you'll know it's ours because it'll talk about us being located in Cary, North Carolina. And then I would like to add that also on my Psychology Today, I talk about kind of being allied with the LGBTQ plus and being affirming. And I think that's really important. I want to add that I'm affirming of identities, whether that be ethnic and racial minorities, gender or sexual orientation minorities or people who are neurodiverse. I think that's very important, that I want people to feel safe when they meet with me, and I'm not going to negate your experiences.
Yeah, no, that's awesome. And I appreciate you adding that in because there are some people that really, find that to be very important for their treatment, so the fact that you kind of added those bits in there for people to know about is really cool. Awesome, Ryan. Well, thanks for coming on the show, man. I really appreciate you taking the time to share a little bit about you and your practice and kind of your approach with clients. It's been really great and insightful. Maybe we could do it again in the future. How does that sound?
That sounds great. I had a great time and appreciate you providing the space for clinicians to kind of talk and share expertise and get the word out.
Yeah, absolutely. Right on, Ryan. Well, thanks again for hopping on. And everybody, thank you for signing in to today's episode. And until the next one, signing out.